Well, thank you very much to the four presenters for very clear and interesting presentations that showed us a variety of methods, participatory research, the modification application of tools for assessing micronutrient deficiency, and then two studies that looked at mixed methods for helping us to understand animal source foods and the diets associated with an agroecological model. Let me open it up to the audience for questions.
I have two questions. I'm Sudha. I have two questions, one for Tulika and one for Anna. Tulika, when you were showing the assessment, like you talked about iron-rich foods, very few being there. I mean, aren't green leafy vegetables iron-rich foods? And in those parts, I guess there's bathua, there's moringa, which is not being used but is available. So I just wanted that clarification. And Anna, wonderful. I mean, I think there's a lot of stuff to unpack there. But one question that I did have was, you've shown that agroecological farming does improve the quality of diet. But were these farmers able to meet their nutritional requirements? I mean, could you comment on that?
My question is to Anna. I wonder to know the classification of agroecology farmer and the conventional farmer. When we talk about agroecology, it may be depend on different contexts. Therefore, what are they living in the same locality so that you can differentiate those farmers who adopt, diversified farming practice more related to nutrition? If there is difference in terms of other variables, how do you control that variability? Thank you.
Yeah, thanks to the panel for very interesting presentations. My question goes to Tulika, of course. I always I think it's an interesting model you've set up, but I always get a bit worried when I see fortification and biofortification set up as an either-or type of model. And that is because, you weren't in the example you gave, for example, wasn't in an area where sweet potato was being produced. But if you're eating an orange flesh sweet potato, you get a lot more than vitamin A. Vitamin C, K, E, range of B vitamins, manganese, phosphorus, all sorts of minerals. So, just focusing on the single micronutrient misses the whole advantage of eating a food as opposed to having sugar fortified with vitamin A, or just oil where you're just getting a macronutrient, or carbos and fat with the vitamin A. So I think these kind of models can be very dangerous in the sense that they simplify what the message would be. I think we need all three approaches. And, because over time we're in the best shape if we do make our staple foods as micronutrient rich as possible, because no matter what model you're seeing of diets being promoted in the, in healthy diet context, still 50% of the calories are going to come from whole grains, roots, and tubers. So if we can make those calories better, we should. And in the case so I really worry about that. The other thing on biofortification is you're seeing it as just the thing being grown, but also biofortified crops increasingly would be value added and come in to fortify other foods. So I think we need a broader perspective in that kind of modeling. Where are the other food vehicles that biofortified crops could contribute to? So an interesting exercise, but I think conceptually we have to be very cautious, because when we set these things up as either or, then we get into trouble.
Great. So maybe if I could turn that into a question, is it possible to allow for all solutions? So let me to add my 2 cents. So let me turn it over to the panelists, and then we will open up for another round of questions. So let's go, we'll just work this way.
I didn't have any.
Yeah.
Oh, okay, sorry. Okay, so thanks for your question about moringa being iron rich. So I think we were just basing it on what people are actually consuming. So we had a nutritionist who was looking at.
Batua.
Sorry?
Batua.
Yeah, right. But they have to report that they're consuming it for us to say that they're having access to it. This is not about what they can have, but what they're actually consuming. So we were just, categorizing all the different food groups and their access to that, and the data suggests that they were not really consuming those. And this was based on 7-day recall, which is what was there in the survey, which is not 24 or 30 days either ways. So Jan, you make a really good point, and I don't think the entire exercise is meant to be an either-or exercise, but at the same time, it is trying to guide donors in figuring out where to allocate the resources. So this is, if our detailed report is out there, and the entire message over there is a mix of interventions is needed, and supplementation in the short term is needed. In the long term, you have to focus on quality of diets, and it includes the notion of biofortification in that perspective. But when you are trying to figure out where to put your resources and which biofortified crops to focus on, it's merely providing a way to get a broader perspective on where the investments will be most appropriate. So if you are talking about a vitamin A fortification program, a vitamin A biofortification program, you're trying to think of whether we should biofortify A by Z crops for a particular country, then you need to consider what is going on in fortification. That's merely the point, so it helps you allocate it, not to say that that's not important. And one of the things that we also conclude in the study and say quite clearly is that in generally, when an important piece is to make sure that the seed systems and the work that's going on there should think about developing micronutrient-rich traits. Basically breeding for nutrition is an important goal for them to also consider. So some of those policy level conversations and awareness around this issue of breeding for nutrition is important for that context. So it is done for explicit framing in mind that there are limited resources, and how do you then make your allocation decisions. It's not an either-or exercise.
Thank you. And Anna?
Thank you for your excellent questions. I think the first one was whether or not farmers were meeting their nutrient requirements. That's a very good question. The short answer would be that most likely a lot of them are and a lot of them are not. If you're familiar with the Minimum Dietary Diversity for Women, the MDDW, this is actually the food grouping classification system that we used. And this MDDW provides a cutoff. If people are at 5 groups out of 10, then at the population level of that, or in the sample that you're working with, it's likely that people are, for the most part, meeting their nutrient needs. Now, what happened is, with us, agroecological farmers were clearly above this cutoff. They were at 5.9. Now, the conventional farmers, they were just below this cutoff. So to us, that means that there are probably people who do and people who don't meet their nutrient needs, and perhaps certain nutrients that were particularly problematic are similar as in other populations, like iron, for example. But we could talk more about certain details in terms of the age groups we were looking at and whatnot. And then as far as the classification of agroecological and conventional farmers, the way we did this is we spoke to a farmer who was identified by local agroecology leaders as participating in agroecological associations. We would go to their house, and then we would look for a neighbor. And so this allowed us to control for certain factors at the community level, especially things like distance to market and ecological niche. And then we also controlled for certain socioeconomic variables. We considered, of course, income, education, age, that kind of thing. And so we were able to control for that. The way that we decided whether or not someone counted as agroecological or conventional, we did not assess their production strategies, because that's really at the base of agroecology, but that's also really subjective. So we trusted that if someone was part of an agroecological farmers association, we assumed that they were meeting that association's criteria, however they defined it, meaning that they were agroecological. Thank you.
Thank you. All right, so we'll take another round of questions, 3 questions, and let the panelists answer. Thanks.
Thank you for the excellent papers. I had questions for Anthony and for Tulika. Anthony, this is just a question related to, you spoke about maize and groundnut as being most affected commodities. I was wondering, what are the varieties of maize that are, or does variety matter in terms of aflatoxin infestation? So, you know, you have the desi maize and then you have the hybrid maize. And also whether large-scale monoculture production of maize contributes greater, to this problem in a more significant manner. And to Tulika, I had a couple of questions on fortification. You mentioned that fortification is mostly happening in branded products. And one of the debates around fortification has been that the people who are purchasing these branded products, are they the ones who are in fact in need of fortification, or are they already fulfilling their nutritional requirements? And in that case, then, are there concerns related to overdosing of specific nutrients, iron, iodine, for example, if you can comment on that? And the products that have been chosen for fortification, oil and sugar, as you mentioned, there are now increasing concerns both about oil, the kind of processed oil that's being consumed, as well as about sugar. And would fortification then, how would that transform people's perspectives about these products? Like, you know, candies, for example, with vitamins are considered to be vitamins, but really they're top of the food pyramid products that children should not really be consuming in those kinds of quantities.
Any more questions? Sorry, okay, go ahead.
The question is to Anthony Wendt regarding the mycotoxin contamination. I just want to know, you were talking about the hermetic grain storage bags. So what is the follow-up on the use of these bags in the households where you have studied? And did you test for the aflatoxin contamination after storing in these bags in comparison to the non-hermetic bags? And among the foods tested, which one of those benefited the most from storage in these bags in terms of the extent of contamination? Thank you.
So thank you for your questions. It would be great if we could ask some questions about the methods and tools as well. So if anyone has Jody, because given that it's a session on methods and tools, I think we'd welcome additional questions on that.
Yeah, so it's a great set of approaches. I'm interested in the Timor-Leste study, and I was wondering, so you used WEA and you used qualitative methods, and I wondered if you could tell us a bit more about how you integrated those. Did you do the WEA first and then investigate interesting things through qual, or did you do both at the same time? If you could tell us about how you combined those methods, that would be great.
Thanks. And I'm going to take the prerogative of being the chair and ask Anthony a question about your methodology, which I found really interesting. I wondered if you could say a bit about how you dealt with, or if it came up, sort of the power politics working within a community. Thank you. So let's start with Anthony, I guess.
Yeah. Okay, wow, really amazing questions. Hopefully I can do a satisfactory job in answering them. The first question came about the varieties of maize and groundnuts. As you might have noticed in the figure, and as is sort of generally known, maize and groundnuts are the most susceptible commodities to aflatoxins. And actually, there are some really interesting perspectives we can take on the varieties that are being used. In my particular district, groundnuts are really not something that the farmers know a lot about. They usually plant them to satisfy their own culinary needs with seeds provided free by KVK, Krishi Vigyan Kendra, the scientific center. And these are like really poor seeds from Rajasthan, a desert state, and they're totally incompatible with the Unnao cropping system, but the farmers don't have necessarily any motive to change the variety of groundnut that they're using. With maize, the story is a bit more interesting because in this region, maize is cultivated in 2 consecutive seasons, once during the dry Zayed season and once during the wet monsoon season. And actually, the monsoon season grain is the one that most of the households keep for their own household consumption. And for that, they prefer the local Desi variety, which is a smaller, denser kernel. And this has interesting implications for the mycotoxin susceptibility too, because the small dense kernel is harder for the fungus to penetrate, coupled with better growing conditions in the monsoon growing season means healthier plants. So usually the maize that is produced in the monsoon season is a more resistant Desi variety, and that is actually the one that's being consumed in the household. And incidentally, during the Zayed season, the summer season, where it's much drier and where aflatoxin is more prone to develop, farmers are growing these hybrid seeds, which fetch a higher price on the market, and they're selling most of that produce, which is usually more contaminated with mycotoxins, onto the market. So in a way, they're filling the need of the livestock feed supply chain by contributing more aflatoxic grain to that market, while their own household consumption is usually a bit safer because they're growing safer maize in better growing conditions for their own household consumption. Does that satisfy that question? Okay. Then the very important issue of follow-up on the hermetic storage system. So actually, due to the very participatory and farmer-driven nature of my project, the hermetic storage system that the householders wanted to use was up to their choice in terms of what crops they wanted to use. And because of the blended priorities, which I talked about, most of the farmers ended up storing wheat in their hermetic sacks, because that is the crop which they are most concerned about spoilage in, and they're storing for the longest amount of time. And anyone who's familiar with the aflatoxin literature knows that wheat is not a very susceptible commodity to aflatoxins. But we did have some small fraction of farmers that are storing more susceptible commodities like maize or pearl millets, which are, and in those commodities, we have seen that over storage time, these are increasing. But it won't be until the end of this coming growing season where I'll have the data to determine whether that trajectory is there. I can speak for the wheat that came out of the hermetic storage bags, which we analyzed for deoxynivalenol, a very serious wheat mycotoxin, that there was virtually no deoxynivalenol in the wheat, even after storage in any of the products. So it's a rather clean wheat food chain, we think. The last thing is how to deal with the local power dynamics, which is extremely challenging thing to do. And my farmer research network was really initiated without any pre-existing model for local farmer governance. There was no self-help group, no NGO project that could serve as an organizational foundation. So we really started our entry points by tapping into local pradhans, the village leaders. But in most of these rural Indian villages, the pradhans are definitely a biased cohort of people who have connections only to the top tier, the wealthiest people. And so we used their household as the entry point for us to then channel our efforts into the more underserved parts of the communities. And it ended up in most cases that aside from providing a physical space for us to meet, the pradhans, the village leaders, took a rather secondary role in the project activities and gave the people of lower castes or lower classes the opportunity to speak up. But of course, the people with more power are usually also the people with more education and perhaps can better translate the insights. And so all of these power dynamics are useful in our meetings, and navigating them is always going to be a challenge.
Thanks for those questions, Richa. As you can imagine, those things came up in the research also. In fact, this whole idea of branded products reaching a certain clientele is one of the basis for an advantage for biofortification, right? Because it gets to the populations that are not consuming these products from there. But actually, interestingly, what it turns out is that, particularly in Eastern Europe, Uttar Pradesh, we did find that even in the low quintile populations and even in populations where there are women-headed households or female-headed households, there's actually fair degree of penetration of branded flour, for example. And also oil and sugars reach, say for example in Zambia, has been pretty significant. So, contrary to what one would expect, certain products are actually making their way into the rural areas also, and which is why it is particularly important to consider where the advantage will be for biofortification. But that said, an important piece that you mentioned was what is called effective coverage in the literature. Are you getting the micronutrients to the people who are actually deficient? And that requires in fortification, one of the, sort of the drawbacks in the fortification field is that you really need to monitor very well. First of all, you need to make sure there's adequate micronutrient in it so that you're getting the micronutrient to them. But at the same time, you need to make sure you're not getting too much. And there have been papers in Zambia where there is certain populations have reported vitamin A beyond the level that they need. So that is definitely a concern and something to watch for. And therefore, coming up with the strategy on fortification, you have to really understand the strength of the systems to implement this program. I said fortification is cost effective, but I also said in the report that cost effectiveness is contextual. If you don't have the systems to monitor and verify, then first of all, your costs are going to be super high, or you're not going to be effective, or you can cause harm. So it's really context dependent. Cannot answer this question without knowing which geography you're talking about. The oil sugar piece also came up quite a bit. And this is where it is interesting. Oil sugar is a problem, but also promoting staples, and particularly monocrop staples, is also a problem, right? So if you biofortify them because 80% of Ugandans are having maize, and then you say, oh, now this has got vitamin A and somehow it's better, is also a similar problem. And I think that what I said at the end of the talk about this voluntary versus mandatory is kind of important. You kind of want to slip it in. It needs to be fluoride and water kind of a solution. So which means that if you have a mandatory standard for oil and sugar, you're not talking about promoting it. People are going to have oil, people are going to have sugar, and you're sticking it in. And when it is voluntary, then yes, what you said is a problem. So you have to, again, sort of think about regulations accordingly, and hopefully that answers your question.
So for our final question, I know we're running a little short on time. No worries, I'll be short. Thank you so much for your question, Jody. So in terms of how we organize the quantitative and the qualitative, so we started doing, so we knew we were going to do 4 visits to the same household. So we started with the production and dietary diversity, and we went for the first 2 rounds, and that's what we did, to get the trust of participants, and then also to be able to adapt the tool well to the reality and to the themes that were coming up of what was most interesting in terms of nutrition and production and the relationship in those households. So then so in the 3rd iteration, that's when we went and we had already this relationship with the mothers, and then we tried to also reach to the partners or the male adult. It was rice harvest season, so it was a bit tricky, and we got less response male, but we still got more than 100 completed surveys for both in the same household, because I was very interested too in the gender parity index, but I'm not there yet. But we'll be looking at this. And so what we did also was, so we contextualized the responses of the OAI. We expanded it for the interesting, more livestock-related components. We pre-tested it, and then we went to the communities. And the reason also to do it in the 3rd iteration was also so the team that I was working with, we had been working then together for a good while, and so the capacity was and the cohesion of the group was a lot stronger. And I also think that having the trust with participants hopefully reduced the response desirability. And so after all this, and not having done proper analysis, but having a sense of the information, then we crafted the qualitative, those semi-structured interviews questions to then do it in the last iteration. So we were hoping to get really specific answers of the topics that were more unclear, and also hopefully having the trust and a bit the fatigue of the participants that were like, then go home. Stop asking what we eat. But thank you.
Thank you. I think we can all agree that these were 4 stimulating presentations. So thank you to the speakers. Again, 3 very provocative and stimulating presentations. From a methods perspective, as we think about the questions we want to ask, I guess my observation is that these methods really explicitly address how critical context is. And so we had a comparative study in Taiwan that drew on historical data. The study in India clearly drew on a lot of different sources of data. And then the study on the pathogens used literature review, expert opinion. So really, context is important. Let's go ahead and see if there are questions in the audience. We will break it in about 7 minutes. We have one question over there after you.
Okay, so my question is for Sudha and Rayu. When talking about traditional foods and traditional diets, I think we've seen how sometimes people sort of conflate traditional diets with a certain past in which there was maybe more hunger, more famines, and more difficulties with access to food. And then so they sometimes say no, traditional diets were not healthy. I wonder if you guys kind of have a response that you usually give to that sort of comment.
Okay, and we'll take, and then.
My question is also for Sudha. You sort of ended the presentation looking at a document from 1983 that didn't list buttermilk, and it was very interesting to see. Just wondering for more researchers working in India, what recommendations do you have sort of for what are the places to look and how do we find these documents that are obviously lost, and where your recommendations for just beyond focus group discussions or asking communities? Obviously there's a need to dig deeper than that, so any comments on that would be useful.
And one more question, the gentleman in the red.
This is a reading regarding the milk availability in UP. As such, we have the latest figure says it's more than 300 grams. This is a valid data, in fact, because we are working on these statistics. But probably you might have studied an area where there is no link or the supply chain facility for the milk and all. So even other studies says it's around less than 100. It would be wrong, I believe.
Thank you. And well, given that, all right, one quick question, and then we're going to turn it over to our panelists.
This UP Sitapur study is really, it's very interesting. So it's really correct that food transitions, dietary transitions are happening because the safety in agriculture and nutrition values are declining. It's correct. I belong to UP, so I just want to comment on this. But we should also try to understand what is the hunger deaths, whether earlier, before Green Revolution or even 50 years back, whether hunger deaths were earlier more or after Green Revolution or in current, after say for example 2000, what is the extent of deaths, current, difference between say for example before Green Revolution or after Green Revolution, what is the difference there? And also, what is the disease pattern now as per our shift in food or dietary habits takes place? So these are some of the things I think would be interesting perhaps.
Okay, thank you very much. We have 5 minutes, so I'm going to ask that you try to respond briefly, and perhaps you can have conversations.
Yeah. Anna, I think about famines, my collaborator Richa sitting here, who's done a lot of research on famine, so I think that should be an offline conversation. Also, I think that question and the last questioner, the inequality data, the inequity really contributes to this discussion. Also about the milk availability. This is a milk producing region. There's a lot of milk here. But who gets that milk, right? The milk is all ending up at the dairy and being supplied to Lucknow, right? So availability does not translate to consumption. So when we look at consumption data and then when we disaggregate it across income levels, we see it's like the lowest income level and the highest. The highest is consuming 3 to 5 times as much milk as the lowest income level. So I think there's this huge variation which does not get recorded when we look at average numbers. Hunger deaths, again, I think that's something we can talk offline, but I'll just say that and just about the experience of hunger. So I think hunger has to be understood, actual hunger and cultural hunger also. I don't know if there's such a term, but I think what people were eating and what they felt about what they were eating plays a huge role. If they were eating the food of the poor, I mean, I've talked to women who were just eating fish, right, all day long. Now, fish is nutritious. Everyone says now you should eat fish. But they felt shameful that they were only eating fish, that they didn't have wheat. So I think we have to look at, I mean, I'm hoping we can further work on these, you know, what is really hunger, and then what were the drivers? Because we feel that post-2000, when workers became more empowered, is when their hunger dropped. And that's what people are saying. It's not the Green Revolution.
Thank you. And to our final speaker.
Yeah, I try to address the traditional diets, they're healthy or unhealthy. It really depends. For the population, like in Taiwan Islands, that the people live in the very natural, very rich, the food resources. There is no famine, and also there is no seasonality issues. And people eat the plant foods and also animal source food, and based on the seasons. So based on the whole year calendars, so that's no problems. However, another issue is we cannot really bring people back to the past lifestyles, but we can bring the past, the traditional, the good things back to our current systems, and how we can bring those good things into our current food systems.
Well, I want to thank all of the speakers for a wonderful session, super interesting work. Thank you for your presentations.